I want to thank you all very much. I now recognize myself for questions. Dr. Singer, I understand you published a study earlier this year regarding the Hippocratic Oath and how it should be adapted. In this study, you note that medical schools are straying further from the traditions of their oaths. You specifically note that none of these oaths prioritize or consistently apply a commitment to individual patient autonomy. In your opinion, why is it important for medical school graduates to swear an oath that reveres patients' rights and autonomy?
Well, thank you, Mr. Chairman. In my study about the Hippocratic Oath, actually, even going back to the original one from Hippocrates of Kos, there tends to be, there's not enough emphasis on the fact that the patient is a sovereign adult with rights that we need to respect, and that we as physicians are basically consultants giving our best opinion to these patients. We're not their bosses. We don't make decisions for them. We just tell them what we, based on our best knowledge, what we think is the best course for them to follow. And in recent years, the Hippocratic oaths that are administered at various medical schools have strayed further and further from an oath that originally didn't give enough respect to patient autonomy, and now has gone far astray. Some of the oaths don't even discuss much about patient care. So what I argue is that we need to get back to focusing on what we as physicians graduating from medical school need to commit ourselves to, which is to respect the rights of our patients, to look at our patients in much in a way as clients, and we're their consultants. And we're ethically obligated to tell them everything we know, not to withhold information from them that they are entitled to know if we know this information. And at the end of the day, respect whatever the decision they make, because they're the boss, we're the consultants.
Thank you. I want to talk a minute about off-label treatments. It's long been understood that the FDA is not in the business of regulating the practice of medicine. This includes a physician's right to prescribe FDA-approved medications off-label, meaning that the approved drug is used outside the specific scope of the approval. Off-label medications are critical to providing necessary care for millions of Americans, often patients who have few or no approved medications for their conditions. Studies have estimated that up to 20 to 30% of all prescriptions are for off-label uses. I'm a podiatrist. I often prescribe nitroglycerin. Why? For patients with rainouts, so that when they're going to be exposed to cold, they can put a nitroglycerin patch over their posterior tibial artery, and their foot will be perfused with oxygen and blood during that time, and therefore averting amputations. It worked every time. A federal appeals court recently revived a lawsuit against the FDA, which alleges the agency surpassed its authority and waded into the regulation of medicine. One such example is the FDA's now infamous tweet from August of 2021. You can see the poster. "You are not a horse, you are not a cow. Seriously, y'all, stop it." That's from the FDA. Let me tell you, I worked in a drugstore in high school, and I can remember a time where a medicine that we commonly dispensed, I looked at the label and I saw the name of the patient was Spot. It was for a dog. I understood what that was about. It was a human medication that is also used for an animal. This tweet is condescending in every single way, and it's palpable, and it's incorrect, and it's misleading, and this is coming from the FDA. Not to mention, the FDA appears to conflate the off-label usage of FDA-approved human-grade ivermectin with its veterinary counterpart. Dr. Williams, as a child and adult neurologist, you've been using off-label medications for years prior to COVID-19, is that right? Yes. Including drugs like ivermectin and hydroxychloroquine? And did you ever have a problem obtaining them for your patients prior to COVID?
Many times.
Do you believe that actions taken by the FDA or other federal officials may have caused this?
Yes, without question.
Dr. Singer, why it's important to preserve a doctor's right to prescribe medications off-label?
Well, first of all, much of clinical knowledge comes from prescribing drugs off-label. We read in the medical literature much of the time comparative effectiveness studies showing how different drugs that were developed for one particular disease appear to have a use in another disease, and then we doctors, especially when there's a scientific rationale for it, we doctors sometimes use that on our patients in certain clinical situations, and then we share our experiences. Sometimes as time goes on, we learn that it turns out that it wasn't what we thought it was cracked up to be, and we pass the word along and abandon it. But other times, we find that indeed this is an excellent treatment, and eventually the FDA comes around and revises its recommendations for use. So, but this is the way we gain scientific knowledge in the clinical field. You really can't gain knowledge unless you try different things and report on it to your colleagues.
Yeah, and not to pick on you, Dr. Singer, but I look at minoxidil, which was approved for treating high blood pressure, but a side effect was hirsutism and hair growth, so dermatologists started mixing it off-label with lotion for hair growth, and now we see where that's now used commonly. You know, I want to talk about missed appointments a little bit. Because of disruptions in care during the pandemic, the number of patients who were screened for cancer fell significantly. Correspondingly, the numbers of diagnoses also fell off. Early stage cancer diagnosis fell by almost 20% in 2020. A recent study in Lancet Oncology found that this has now led to an increase in diagnosis of deadly late-stage cancers across almost all types of cancer. Dr. Singer, are you seeing similar trends in your field?
Chairman Wenstrup, yes. In fact, we even saw this during the darkest days of the pandemic. I'm a general surgeon, so among the spectrum of diseases that I'll deal with is, for example, appendicitis or diverticulitis. We were seeing patients show up in the emergency department with very advanced cases, several-day-old ruptured appendicitis or ruptured diverticulitis or peritonitis, the kind of thing we rarely see in our developed society these days. And since then, too, we've seen an unusually large number of people presenting to our office with surgical problems that are in a much more advanced state than we're accustomed to seeing them as.
I appreciate that. You know, in the early days, everyone was scared. So, you understand, thought we just need to shut everything down. But what I have concerns about is, were we looking at local levels? I mean, I even had a sheriff call me because someone who was scheduled for their painful hernia, their case was canceled at a time when in that county there were no cases of COVID, and he ended up taking his life because he was in so much pain. So, lessons learned, I think we ought to take into consideration what's going on at a local level. And I do want to take just the opportunity to discuss off-label again a little bit and give Dr. Khatibi and Dr. Shane both a chance to give your thoughts on the use of medications off-label in general.
Certainly, in my practice of ophthalmology, we use off-label drugs all the time. If we didn't, we would actually have a lot less of an arsenal of drugs to use against diseases. So it's an integral part of medical care, and the government shouldn't be dictating to you the off-label uses that actually aren't potentially very dangerous to patients and make sense. And especially in a late-stage case or something where you just no other options, it's a good thing to have to be able to utilize.
We passed a bill here several years ago relating to the right to try. So, Dr. Shane.
Thank you, Chairman Wenstrup. In pediatrics, I have actually had several opportunities to use medications off-label. Unfortunately, because many medications are not tried in children as part of clinical trials, we're often forced to do that. And so one of the really potential ways that we can optimize that is by including children in clinical trials so we can gather data and medications do not have to be used off-label. Thank you.
Thank you. Thank you all for your input here.